Hello. First, I will perform hand hygiene and I will introduce myself to my patient. Hello, my name is Shaquila. I'm going to be the nurse practitioner taking care of you today. I'm going to be doing a musculoskeletal exam on you today. Could you tell me your name?
Alex.
Hi, Alex. Do you give me permission to record and upload this video to YouTube so that my professor can view it and grade it?
Yes.
Okay. First, I would start my assessment by inspecting my patient's hands. I would inspect her hands. I'm looking for any nodules, any redness, any swelling, looking at joint symmetry, and looking for muscular atrophy. And I don't see any. Next, I would palpate each finger, distal and proximal, and the phalanges, feeling for any nodules, any warmth, any redness, any swelling. I don't feel any. Next, I will do range of motion. Can you make a fist? Can you extend your fingers? Can you spread your fingers out and bring them back in? And bring your thumb in and out. Okay, good range of motion noted to my patient's fingers. Next, I would inspect my patient's wrist. Can I look at your wrist? I'm also looking at joint symmetry, looking for muscular atrophy, any swelling, redness, or deformities on the wrist. I don't see any. Next, I would palpate the wrist. Is that tender any?
No.
No tender, no pain. Next, I would do range of motion to my patient's wrist. Can you point up to the ceiling, down to the floor, point inward and outward? Next, I'm going to do the specialty test for the wrist, which would be the Tinel's test, checking for carpal tunnel. I'm going to tap on the medial nerve. Is that painful?
No.
Is that painful?
No.
Okay. And next is the phalanx test. Can you do your hands like that? I will have my patient hold her hands this way for 40 to 60 seconds, noting if it's painful. Is that painful?
No.
Okay. She says it's not painful. That's fine. Next, I would inspect my patient's elbows. I'm looking for any redness, swelling, any deformities, and looking at joint symmetry. Everything is nice and symmetric. Next, I'm going to palpate the elbows, feeling in the grooves as well. Okay. Next, I'm going to do range of motion to my patient's elbows. Can you bring your arms up and out like you're holding a bowl of soup and pouring it out? Good range of motion to my patient's elbows. Next, I'm going to inspect my patient's shoulders. I'm inspecting for symmetry, nice and symmetric, looking for any redness, any swelling, any deformities, and I don't see any. Next, I'm going to have you sit here. Let's turn around. Next, I'm going to palpate my patient's shoulders. I'm going to find the acromial clavicle and palpate that joint, the biceps groove, the tubercle of humerus, and the corticoid process, and the subdeltoid bursa. Okay. Next, I'm going to have you do range of motion. Can you hold your arms up and back and out to the sides and in and up like this and out? And come in like this and out. Okay. Next, I'm going to do the empty can test, specialty test for the shoulders. Can you extend your arms and external? Turn them out and don't let me push down. Okay. That's the empty cans test. Next, I'm going to inspect my patient's neck and head and neck, looking for any abnormalities, any redness, swelling. Looking at the symmetry of it, nice and symmetric. Next, I will palpate the spine, the cervical spine, and then I will do range of motion. Can you turn your head side to side, chin to chest, up to the ceiling, ear to shoulder, ear to shoulder. Okay, that's good range of motion noted to my patient's head. Next, I'm gonna check for TMJ. Can you open your mouth and close it and move your jaw side to side? Okay. I didn't feel any clicking or popping or anything. So I didn't notice any problems with her TMJ. Next, I'm going to palpate the, I'm going to do the Sperling's test. Okay. Any pain?
No.
Okay, no pain noted. Next, I would start with her toes. Well, I'm going to inspect her feet and toes, and I'm also going to have her stand on because I'm inspecting my patient for being flat-footed. Okay, she's not flat-footed. Sit down. Now I'm going to inspect her toes, looking for any redness, any nodules, any I'm looking at joint symmetry, muscular atrophy, and I don't see any. Then I would palpate each toe, feeling the nodules, feeling, is it painful? Is it nodules, redness, or swelling? Don't feel any. Can you do range of motion to the toes next? Can you point your toes upward, downward, inward, in, and out? Next, I'm going to inspect the ankles. I'm looking at the ankles for any redness, swelling, any, I'm looking at joint symmetry. And I don't see any. Next, I'm going to palpate the ankles. Is that tender any?
No.
Okay. Next, I'm going to do range of motion to the ankles. Can you turn your feet in, out, up, and down? And I'm also going to do, that was passive, I'm going to do active. In, out, up, down. Okay. Next, I'm going to do the knees. I'm going to inspect my patient knees, looking for any swelling, redness, and any nodules, anything. I don't see any. Next, I will palpate the knees. And then do range of motion. Can you bring your knees up together, both together and down? Okay. And then I'm going to have my patient lie down. And I'm going to do my specialty test of the knees. The first one is the valgus. And I'm going to have you bring your knee up. Okay. Push up and inward. And the varus. And then I'll do the Latchmans. Is doing this. And then the Drawman, can you bring your knee up? Both of your knees up. And I'm going to push and pull. And the McMurray's sign. Rotating in and out. Any pain?
No.
Okay. Those are you can sit up. Those are my specialty tests of the knees. Next, I'm going to inspect my patient's hip. Can you stand up? Looking for any swelling, any deformities, looking at see if they're symmetric. And then I would palpate the hips. Okay. Then I would do range of motion. Can you extend one leg out and down, the other leg out and down, back and up, down, the other one back, okay, and then outward and inward and outward and inward. Okay. Next, I would do the Thomas test. I'm gonna put you on the bed. Lay down for me. Bring one leg. Is that painful?
No.
Okay. Do the other leg. Is that painful?
No.
Okay. And the Patrick's test. Okay. Okay. All right. You can sit back up. Next, I would have her stand up, inspect your spine. I'm inspecting for any scoliosis, lordosis, kyphosis. And I don't see any of that. Then I would palpate the spine. Is that tender any?
No.
Okay. And do range of motion to my patient's spine. Can you bend over and touch your toes? And stand back up and look back. Okay. Can you go side to side? Okay. Lean to this side and lean to that side. I also would check the creases below the buttocks, but I'm not going to do it on camera. But I would check that. Then I would inspect I think that's it. No, one more test, the straight leg test. I will have her lay down. Okay. Okay. And that's the end of my musculoskeletal exam.